Thank you and welcome everyone. I would like to present you the topic of my PhD thesis, which is New Insights into the Application of Teledermatology. I am Martyin. I am a medical doctor and a first-year PhD student, and I believe that the latest technological improvements should be implemented in patient care as soon as possible. Therefore, we are working on providing reliable data to facilitate the widespread use of teledermatology. I currently have two ongoing projects. The first one is comparing the diagnostic accuracy of teledermatology systems to face-to-face examination in the diagnosis of skin diseases through a systematic review and meta-analysis. Skin diseases affect a significant portion of the global population, with a shocking 3 billion people lacking appropriate care worldwide. The number of dermatologists per 100,000 people show us the disparities in the available dermatological care worldwide. This number is 7 in Germany, 3.4 in the USA, and a mere 0.7 in Indonesia. The cost of a conventional face-to-face visit costs around $100 US, while teledermatology visits cost significantly less, approximately $40 US. In light of these factors, teledermatology stands out as a crucial tool in facilitating timely and affordable care worldwide, yet there is still some data missing regarding its reliability in the everyday practice. The most common method of teledermatology is the direct store and forward method, which means that the patient directly contacts the dermatologist, and this connection is separated by time and space. Our clinical question is whether teledermatology systems are as reliable as face-to-face examinations in the diagnosis of dermatological diseases. We would like to compare diagnoses made via teledermatology systems to diagnoses made during face-to-face examinations, and the outcome of interest is diagnostic accuracy. Our hypothesis is that teledermatology systems have non-inferior diagnostic accuracy to face-to-face examinations. We conducted a systematic search in the 3 main databases. Here you can see the search key and the results, and we ended up with more than 200 eligible full texts. We currently finished the analysis on the general skin condition group, which contains all kinds of skin disorders without exceptions, and there is still some ongoing analysis on other patient groups and secondary outcomes. So on this slide, we investigated the proportion of diagnostic agreement between teledermatology and in-person examination in the subgroup of general skin conditions. On the left side, you can see a detailed forest plot with all the articles listed, and on the right side, you can see a summary of the results for better comprehension. We included more than 90 clinical studies with more than 25,000 cases overall. And as you can see, the diagnostic agreement in the store and forward group was found to be 0.75, which means that in 75% of the cases, the teledermatology and the in-person examination resulted in the same diagnosis. This number is 73% in the case of real-time and 85% in the case of the hybrid method. These results show us that the cheapest and most available method, which is the store and forward method, has also comparable results to the other methods. Therefore, it can be accessible way of teledermatology. However, the hybrid method tends to be the most accurate one, as it is the best modeling of an in-person examination. The next subgroup which we investigated is the use of dermoscopy in this patient population. Dermoscopy is a non-invasive in vivo technique with which we can visualize the microstructures of the skin which are not visible to the naked eye. In the group where dermoscopy was used, the proportion of diagnostic agreement was found to be 81%, and in case of lesions diagnosed without dermoscopy, this proportion was found to be 74%. This means that in this patient population, The use of teledermatology is also acceptable without the use of dermoscopy. Therefore, it may provide a chance to use teledermatology for patients and general practitioners who do not have a dermoscope available. The strengths of our study will be that it is going to be the first comprehensive meta-analysis which investigates all types of teledermatological care. We work with a very large sample size, and we have data from all around the world. However, the challenge lies in the diverse study settings and the different reporting of outcomes. Based on our available results, we can conclude that teledermatology is suitable for the remote diagnosis of general skin conditions, and it may provide an alternative method in low resource setting, as the cheapest and most available store and forward method is also acceptable because it has almost the same accuracy as the other methods. Also, we can conclude that dermoscopy is not necessary in the diagnosis of general skin conditions. However, standardized reporting of outcomes should be implemented in research. You can see here the progress of my first project. And let me jump to my second topic, which is investigating the diagnostic accuracy of artificial intelligence systems in the diagnosis of skin diseases through a systematic review and meta-analysis. One of the most discussed advancements of technology at the moment is artificial intelligence, and this is the same case in dermatology. And one of the most interesting aspects of AI-assisted decision-making is the use of these systems in primary care, because 65% of all patients with dermatological problems only consult their general practitioners, who have to make a decision about the urgency of the case. And because of that, they are in need for real-time diagnostic support by AI systems. AI may not only be useful in primary care, but it may also assist specialists, and due to the shortage of dermatologists, it is very important to reduce waiting times and enhance the efficiency. Our aim is to determine the reliability of artificial intelligence systems and determine their role in the everyday practice. Our clinical question is whether artificial intelligence systems are suitable for making a diagnosis. We are going to use the PEERT framework. The population is patients with suspected skin cancer. The index test is diagnosis made by AI systems, which is compared to the reference test of gold standard diagnosis, which is either histopathology or diagnosis made by a dermatologist, and the diagnosis of interest is skin cancer. Our hypothesis is that artificial intelligence systems have non-inferior diagnostic accuracy to dermatologists, and the clinical implication would be the implementation of artificial intelligence-assisted systems to improve patient care. We are currently working on the feasibility of this project. So in summary, I have two projects. The first one is about comparing the diagnostic accuracy of teledermatology, and the second one is investigating the diagnostic accuracy of artificial intelligence systems. Thank you for your attention, and I would like to finish my presentation with the words of Marie Curie: "Nothing in life is to be feared, it is only to be understood." Thank you.
I would like to ask that in your first project, do you plan to investigate other subgroups beside this? And if yes, what other subgroups will you examine?
Yes, thank you for the question. Because of the short time limit, I didn't have the chance to talk about this, but I can show you the other patient populations. We will investigate the accuracy of teledermatology in the skin cancer group, the pigmented lesions group. We have a group called all skin conditions except skin cancer, and also in the dermatitis or eczema group.
I've got one question connected to the previous question. So what about the different age groups? Because the use of smartphone can be different between different age groups.
Yes, thank you for the question. It might be a very interesting question to investigate, as we have articles from pediatric population and adult population as well, so it may be an interesting aspect.
Or the old people's group as well, because they are not so practiced in the use of this device, maybe.
Yes, I think that the indirect method would be the most, which would be the best for them, because then they can have the help of a general practitioner or an assistant to take a photo of the lesions.
Okay, so I just a comment regarding your first topic. So you mentioned different incidency regarding the dermatologists in the different countries. Just you know, there are different systems in the different countries. For example, in Germany, proctology belongs to dermatology, whereas in the States it's a different field of the medicine. And for example, UK, I know it isn't included. But the STI, it's a different healthcare providers. And anyway, during the pandemic, I think most dermatologists use the teledermatology, and sometimes we met interesting and low quality pictures taken by the patient or himself. Is there any technical requirement in these studies? For example, iPhone or Alcatel Touch one is enough, or something else?
We haven't made any exclusion criteria based on the technical requirements, but because of this we have very heterogeneous data, but we plan to investigate the accuracy based on the different technical, what technique is available.
Okay, thank you.